Welcome. So I've been asked to do a couple of videos by some patients who are experiencing hand pain. Now, a couple of them are because of obstacle racing. They have lots of grip training, and it can take its toll on the hands, on the fingers, especially if you're newer to it or you've stepped up your training for any reason. And the others are due to arthritic pain in the hands. So sports massage therapists or even people just with a little bit more wear and tear from a history of manual work. Regardless of the reason, hand pain, forearm pain, elbow pain is generally a symptom of inappropriate mechanics. So the shoulder is out of balance, the neck is out of balance, the hands are overloaded, so you're altering your chain. So this is symptomatic treatment, which will relieve your pain, but it's not going to fix the problem. The problem is either you need to make your forearms and hands stronger, but normally you need to stabilize your shoulder. When you come to doing your hand work, use a massage medium. So either massage wax, massage oil. It can be coconut oil if you cook with that. That works too. I'm going to be using Mighty Green Muscle Balm, CBD Magnesium Balm. I swear by this. I use this on my hands all the time, literally probably most nights. If I've been in treating, doing obstacles, if my hands are done, I use this stuff. So all you're going to do is take a little bit. We're going to start by working through the thumb. We'll work up the chain, and then you're going to do your shoulder stretches as well. So trigger release work for your hands. All you need, a small amount of massage medium. We're going to work through the thenar eminence first. The thenar eminence is the thumb side pad, top and bottom. Okay? And all you're going to do to start with, find the trigger. I hold my thumb, trigger grip, and I'm just self-massaging along the line of the bone, circling around the muscle. My pressure is only maybe a 3 or 4 out of 10. You want it to feel like a sting, but not unbearable pain. We'll get to that. But for the moment, it's just about loosening everything up. So you just circle, loosen. I'm putting a little bit of traction, a little bit of pull on my thumb, which is then opening the joint out. So as I push through, I am actually pressing through the joint here at the base of the thumb. Then I push through to my first digit, and I'm pushing across the line of the bone, circling all the way around the muscle. Great. Circles, it honestly doesn't matter which direction you go in. Technically, you should always massage up the chain, so you should be massaging towards the wrist. I find that uncomfortable, and we're going to flush the arms out anyway, so it doesn't matter too much. But as a guideline, if you're massaging, you should always work up chain, because you're encouraging the fluid up the venous system. Okay, so self-massage, 30 to 60 seconds, but if it feels good, spend as long as you want doing it. Turn the hand over. Again, you're going to work along the inside of the thumb. So I place my hand across the other one, or place it onto your thigh. Keep the hand still, firm pressure, and just run all the way up the thumb. Come into the pad, which is your thenar eminence, this bit right here. Press strongly through and slide all the way up. I'm going to stop there because as you can see, I've sliced my hand open. But for you, you're going to come all the way here. You find the bone and the tendon for the first digit and run all the way up. I'm going to skip. You stay on the finger and you can run all the way up the finger. It actually feels really nice going all the way up the digit. But for you, I would say do it in one smooth line straight up the digit. You can actually do this for the whole of your hand and it'll feel really nice afterwards. When you get to the fingers, just a little bit of traction. So I squeeze the fingers and pull as I go up. So I'm massaging as well as creating a little bit of space and a little bit of pump inside the joint. Okay, technique 2. Trigger release for your thenar. Place 2 fingers on the inside of the pad. It doesn't matter which 2. I always use my middle ones because they're stronger. Thumb goes into the top. You want to find the belly of the muscle and just slide just onto the inside. Don't worry, you're not going to do damage if you do this wrong. You might cause a little bit of bruising, but it won't do you any damage. And you just open and close the hands, trying to make sure you're fully extending, fully flexing all the way through. And this should feel maybe a 3, maybe a 4 out of 10. Sharper, but not unbearable. You can hear I'm talking to you, there's no strain in my voice. And slowly as that relaxes, you're just going to move down towards the thumb. And you're going to keep doing this. I tend to do 3 or 4 hand moves, and that's starting to hurt a little bit. So I've got a lot of pressure, I'm literally hooking onto the inside of my hand. I'm not just resting. It's a strong hook there, and you push on the other side. And effectively what you're trying to do is make the tendon and the muscle belly slide through your fingers. And then you work all the way up the thumb, trying to make sure you get full extension. You see, I was getting a bit lazy and I was stopping there. Full extension, full flexion, all the way up the thumb. And that feels a little bit numb to me. Okay? Then you're going to come over, press through the thumb, strong pressure, open and close. It's more the thumb than anything else. Work your way up, just like you did with the massage, but now it's with movement. All the way up the fingers, all the way up the digit. And I'm pressing with my thumb. I've got strong hands. I'm used to doing this sort of treatment. If you're finding this way too much on the thumb you're pressing, buy yourself a massage tool. You know, just the cheap plastic things, or even a metal one from Amazon. Just type in massage tools and they should come up. But just be careful that you learn the sort of pressure you're putting on before you start going to town on this, because it's a very different feel. I'm opening and closing, strong pressure with the two fingers at the back. I'm just finding the bone for my fifth digit, fixing it there strongly, and then so far as I press, any movement is just flossing under my fingers. And lastly, just rub through, opening your hands out, and you're just biscuit breaking. So if you had two hands, you'd be pulling it apart. Because you've only got one, you use the top hand to pull away from the bottom hand. You can go the opposite way as well, hooking underneath and pressing through. Really get hold of the thumb, gently draw the thumb back to create some space. You get a nice stretch through the webs. Especially if you're hypermobile, that will feel great. Finally, pressure on the outside of the thumb, just sliding along the bone, all the way into the joint. I'm squeezing with my thumb, pressing through. I release, and I squeeze as I press, which creates a bit more tension and will feel great. So my hand feels nice and loose now. Second technique is trigger release for your forearm. Now this is amazing for elbow pain, forearm tension. You don't really get that pump from lifting or from hanging too long. Little bit of massage medium. Again, I'm using Mighty Green massage balm, but you can use anything you prefer. Wax is going to work better, or balm is going to work better than oil, because oil gets really slippery and you want a little bit of friction, but it doesn't matter too much. Start just by coming below the elbow, find the bone on the back of the hand, which is going to be your ulna, and just slide into the muscle belly. So you see I just slide off there and there's a little groove. Start just by running your fingers, about a 3 out of 10 pressure, and you should be able to feel the pressure between the muscles, and effectively you should get down in between the two bones, the radius and ulna, and come all the way down into the hand, into the wrist. Okay, you can see how much pressure I'm putting in. There's a kink in the muscle, but my hands aren't going really white, really blanched. Once you've warmed that up a little bit, 2 finger widths from your elbow, so crease of the elbow, 2 finger widths from the elbow, slide into the middle. That's where your trigger is. Now you'll know if you're on the right place. If you're not sure, you're in the wrong place. I'm placing my thumb under my forearm. I'm squeezing my middle 2 fingers, because for me, those are my strongest fingers. If you'd rather use index, that's fine. The pressure is now a 5 or a 6 out of 10. And just roll circles and feel the muscle belly roll under. So you roll all the way through, make sure you change direction and roll both sides. And again, what you're doing is just flossing the muscle, allowing it to roll under your fingers. After a roughly 10 repetitions, but you can stay longer, I just use it as a guideline, which should take about 30 seconds, slide down about an inch. This will be less painful, but you'll still feel the pressure. Roll down, and you're just going to repeat this literally all the way down the arm every 30 seconds to the point where you get to the bottom. Grip, ulna, push, radius. So I'm pushing with my thumb, gripping with my fingers. Roll the circles, you're going to do both. The idea being that you're moving the 2 bones across each other. And there's a membrane in between the two called the interosseous membrane. You don't need to remember that. It gets a lot of tension built up in it, especially if you've got rounded shoulders, if you've got a very heavy lifting or manual job. Um, we end up quite bound, quite tight, and a lot of forearm and wrist pain can be caused by connective tissue tension underneath the muscle. So just by mobilizing, articulating these bones, giving them something to push off, it's a really great way of pumping out in between these and just getting a small stretch through that area. You're not going to be breaking down scar tissue or any of that sort of stuff. There's nowhere near enough force for that. But you're just allowing a little bit of stretch, which will give you some temporary relief and allow you to use it pain free. Okay? The second technique is exactly the same pressure, trigger point, but instead of circles, flex and extend. Now, it depends why your muscles are tight as to which is going to feel better. If it's primarily from grip work, then in theory, flexion extension will feel better. If it's primarily just from load, from gripping, from weight training sort of thing, from a manual job, you'll probably find the circles better because if it's manual job, it's chronic overload. If you're hanging, gripping, OCR training, then it's a very acute, very short-term load that you've got this blowout from. I mean, 3 hours of racing isn't short-term, but you get what I mean. It's not years. So open as wide as you can. Spread your fingers right back, then close all the way into a fist and flex. And you work up and down, sliding all the way across that muscle. If you're not sure if you're in the right place, you're not in the right place. This should either be uncomfortable or really painful. There's no intermediary in there. Okay. Now, final technique does require a tool. You can use a rolling pin. You can use anything solid. I'm going to use my massage blade because I have it to hand. This just saves my hands in a clinic. But if you type in metal massage blade, you'll get a thing that looks like a Nike swoosh. That's fine. Drop the wrist down, lock the arm straight, and then just slight bend. Remember, I said you're always supposed to go up. You should always go up the chain. Um, up the chain. So literally all you're going to do is scrape the top of the muscle, glide round. This pressure is a 2 to 3, maybe pushing a 4 if you're feeling sadistic. This isn't how hard can I press. It's not about, it's about gliding the pressure and releasing the tension. Because remember, this is only going to give you temporary release. We're not trying to fix anything. If you fix this, fix elbow pain by massaging your forearms, you're mistaken. Do your strengthening work, correct your shoulder problems, and address the nerve issues in your neck. And yes, these will probably stay loose. But until then, just use the temporary release to stop it becoming a really broken, overloaded problem and allow you to function so you can continue to work. Don't think if I do my stretches, pain goes away, therefore it's not a problem. That's not how this works. You're masking the pain. It's like taking a paracetamol. You're not fixing what's causing the pain. So eventually you're going to push it hard enough and it will break. And then you won't be able to do work or sport or children or whatever it is that you're stopping you doing, meaning that you're watching my video. If you can see, like I put a little bit more pressure now, everything's warmed up, and I'm just working in circles all the way around. There is no point going directly on the bone, but I work up to my elbow right into the insertions there, and that's quite nasty. So I'm going to focus on it for a little bit, just work around the area, find the real bite point for it, and then I'm gliding up and scanning again. So it looks like I'm scraping, right? There's no pressure as I go that way, and I'm pressurizing this way because I want to put all the fluid upwards, right? Like I said earlier. So I know it looks like I'm just brushing it. Oh, no pressure. You're not going to do any harm, but you can end up with a bit of fluid pooling in your wrists, which can cause a little bit of discomfort. And it can take a little bit of time for it to go down. You won't get the same amount of release as you should. So working on the inside of the elbow can be really nasty, but really nice at the same time. You know, that really good pain. So all you're doing, scraping on the inside, go gently around the bone. I'm just gliding around the bone, not directly on it, because there's no need. If you're more flexible than me, you could go up your tricep, and this does feel really nice. Nice, relaxed, open forearms, a little bit of pump on them, but absolutely no pain. My hands don't hurt. Can you see the difference in the range of my fingers just from doing a little bit of massage? They should be there. That's me pushing as hard as I can. I know it's quite subtle, but it was for minutes. Minutes.